The origin of the pectoralis major, we have the medial half of the clavicle. The insertion, again, is the lateral lip of the intertubercular groove of the humerus. Actions include adduction, flexion, and medially rotates the arm. And innervation is the lateral pectoral nerve. As for teres major, originates at the lower lateral border and inferior angle of the scapula. The insertion is at the intertubercular groove of the anterior humerus. Actions include medially rotating the arm, adduction of the arm, and extension of the arm. And innervation is the lower subscapular nerve. For the latissimus dorsi, again, the origin is at the spinous process of T7 through L5 vertebrae, the iliac crest of the sacrum, thoracolumbar fascia, the inferior angle of the scapula, and the lower 3-4 ribs. The insertion will be the floor of the intertubercular groove of the humerus. Actions include medially rotating the arm, adduction of the arm, and extension of the arm. And the innervation is the thoracodorsal nerve. And lastly, for the coracobrachialis, it originates at the coracoid process of the scapula. Insertion is at the mid-medial surface of the humerus. Actions include flexion and adduction of the arm, and the innervation is at the musculocutaneous nerve. As for medial rotation of the arm, we have 5 muscles, which is the pectoralis major, anterior deltoid, subscapularis, teres major, latissimus dorsi. So as for the pectoralis major, the origin is the medial half of the clavicle. Insertion is the intertubercular groove of the humerus. Actions include flexion, adduction, and medially rotates the arm. And innervation is the lateral pectoral nerve. For anterior deltoid, we have the origin as the lateral clavicle. Insertion of the tuberosity of the humerus is the insertion for the anterior deltoid is the deltoid tuberosity of the humerus. The actions of the anterior deltoid would be medially rotating the arm, and the innervation would be axillary nerve. For subscapularis, the origin is the subscapular fossa of the scapula. Insertion would be the lesser tubercle of the humerus, and action would be medially rotating arm. Innervation is the upper and lower subscapular nerves. For teres major, we have the lower lateral border and inferior angle of the scapula as the origin. Insertion is the medial lip of the intertubercular groove of the anterior humerus. Actions will be medially rotating the arm, adduction of the arm, extension of the arm. Innervation is the lower subscapular nerve. For latissimus dorsi, again, the origin is the spinous process of T7 through T5 vertebrae, iliac crest of the sacrum, thoracolumbar fascia, inferior angle of the scapula, and the lower 3 to 4 ribs. Insertion is the floor of the intertubercular groove of the humerus. Actions include medially rotating the arm, adduction of the arm, and extension of the arm. And innervation is the thoracodorsal nerve. Now for laterally rotating the arm at the glenohumeral joints, we have 3 muscles, which would be the posterior deltoid, the infraspinatus, and the teres minor, not teres major. So for the posterior deltoid, the origin is at the spine of the scapula. Insertion is the deltoid tuberosity of the humerus. Actions include extension of the arm and laterally rotates the arm, and innervation is the axillary nerve. For the infraspinatus, the origin is the infraspinous fossa of the scapula. Insertion is the greater tubercle of the humerus. Actions include laterally rotating the arm, and the innervation is the suprascapular nerve. And lastly, the teres minor origin is the middle part of the lateral border of the scapula, or the axillary border of the scapula. Insertion is the inferior aspect of the greater tubercle. Actions include laterally rotating the arm, and innervation is the axillary nerve. And as for circumduction of the arm, it's pretty much a combination of flexion, extension, abduction, and adduction, since your arm is going in a circle. So the muscles that were included in those four movements would be the same muscles that's used for circumduction, along with the origins, insertions, actions, and innervations. If you guys were not able to fully see my pictures or my charts, I'm going to go ahead and attach a picture of the actual charts below the video, along with a typed up document in case my handwriting is not legible for some, or some can't see my handwriting. So thank you so much for watching my video, and I hope you guys like it.